Today I am going to show you the dissection of the anterior and medial compartment of thigh. So look at here. First I have give an incision here up to the medial side of the lower part of patella, and I have effect out the skin flap because this is the left lower limb you are seeing here. Then in the superficial fascia, this is the superficial fascia of the anterior compartment of thigh. You can see here, this is the superficial fascia of the anterior compartment of thigh, and in the superficial fascia of the anterior compartment of thigh, especially on the medial side, you are seeing a very important vein, which is the longest superficial vein of the human body, and this is the great saphenous vein or long saphenous vein. So you can see here, this is the great saphenous vein or long saphenous vein here. You can see here, this is the great saphenous vein or long saphenous vein here. Okay, this vein comes from the dorsum of foot, and its formation is by the medial end of dorsal venous arch and medial marginal vein of foot. It passes 2.5 centimeter in front of the medial malleolus. Then it crosses the lower medial surface of the lower one-third of the leg. Then it comes posterior-medial to the knee joint, and it arises and ascends on the anterior-medial side of the thigh. So this whole is the great saphenous vein. You can see very clearly here, this is the great saphenous vein in the superficial fascia. You can see here, this is the great saphenous vein in the superficial fascia of thigh. And this great saphenous vein, it is having so many tributaries. The important tributaries, it is having tributaries in the below the knee. It is having posterior arch vein, anterior leg vein, and some veins from the calf which join this great saphenous vein. Then above the knee in the thigh, it is having two important tributaries. One is the anterolateral vein of the thigh. So you can see here, this is the anterolateral vein of thigh draining into the great saphenous vein. You can see very clearly here, it is the anterolateral vein of thigh. This is the posterior-medial vein of the thigh. This posterior-medial vein of thigh is sometimes known as the accessory saphenous vein. So this is the posterior-medial vein, a tributary of the great saphenous vein. This is the anterolateral vein of thigh, tributary of the great saphenous vein. And you are seeing here, along the upper part of the great saphenous vein, you are seeing this is the vertical limb of the superficial lymph nodes. You can see here, these are the superficial inguinal lymph nodes, and this is the vertical limb of the superficial inguinal lymph nodes. You can see here. Then you are seeing here, before piercing the cribriform fascia through the saphenous opening, it is having other tributaries which correspond with the superficial branches of the femoral artery, and they are the, you can see here, this is the superficial external pudendal vein, this is the superficial epigastric vein, this is the superficial external pudendal vein, and one vein from this side, this is the superficial circumflex iliac vein. So these are the tributaries of the great saphenous vein just before it pierces the cribriform fascia to drain into the femoral vein. Now you can see here, here is the saphenous opening. This is the location of saphenous opening, which is covered in the recent state by the cribriform fascia. This cribriform fascia is pierced by so many structures from superficial to deep and from deep to superficial. That is why it is perforated, and it is known as the cribriform fascia because cribriform means sieve-like. So this is the great saphenous vein here. Now you can see the femoral triangle. The femoral triangle is a triangular depression on the upper one-third of the anterior aspect of the thigh. So this is the femoral triangle. You can see here, this is the femoral triangle. You can see this is the femoral triangle. The femoral triangle is having one apex, one base, one medial boundary, and one lateral boundary. The base of the femoral triangle is formed by the inguinal ligament. The medial boundary is formed by the medial border of the adductor longus muscle. You can see this is the adductor longus muscle here. I have cut it out from here. So this is the adductor longus muscle. So medial border of femoral triangle is formed by the medial border of adductor longus muscle. The lateral border of the femoral triangle is formed by this medial border of sartorius. So this is the sartorius muscle. Apex is formed at the medial lip of linea aspera, which is the meeting point of the sartorius and adductor longus muscle. So this is the apex of the femoral triangle. Now you can see the important contents of the femoral triangle. They are from lateral to medial side. You know, this is the trunk of the femoral nerve. This is the trunk of the femoral nerve here, which is soon divides into anterior and posterior division, and these anterior posterior divisions, they give different branches. The anterior division of the femoral nerve provides a muscular branch to the sartorius muscle. You can see here, this is the muscular branch to the sartorius muscle from the anterior division. You can see here, this is the sartorius, this is the muscular branch from the anterior division to the sartorius muscle. Now, it gives two cutaneous branches. One is the intermediate femoral cutaneous nerve, and the medial femoral cutaneous nerve. This is the medial femoral cutaneous nerve, and this is the intermediate femoral cutaneous nerve. It gives two cutaneous branches. Now, the posterior division of femoral nerve provides muscular branches to all of the muscles except the sartorius, means for the quadriceps femoris and for the articularis genu muscle. So you can see here the quadriceps femoris muscle. This is the rectus femoris. This is the vastus medialis muscle here. You can see this is the vastus medialis. In the lateral side, you can see here, this is the vastus lateralis muscle here. And deep to the rectus femoris, this is the vastus intermedius muscle here. Okay. Now, this is the very important cutaneous branch from the posterior division of the femoral nerve. That is the saphenous nerve. This is the saphenous. This is the longest cutaneous nerve of the human body. The saphenous nerve is the longest cutaneous nerve of the human body. You can see here, this is the saphenous nerve, which is the only cutaneous branch from the posterior division of femoral nerve. Okay. Now, you can see here, this is the nerve to vastus medialis. This is the vastus medialis muscle, and it is supplying the vastus medialis muscle. You can see here, this is the thickest muscular branch of the posterior division of femoral nerve, because it also carrying the proprioceptive fibers from the knee joint. This is the region of its thickness. Now, from the apex of the you can see here in the floor of the femoral triangle, you can see here, this is the adductor longus from the most medial. Then you can see this is the pectineus muscle here. You can see here, this is the pectineus, second muscle. Then just deep to the femoral artery, here is the deep to femoral artery is the psoas tendon of the psoas major muscle. This is the white tendon of psoas major muscle. You can see here, deep to this is the psoas major here, and just lateral to psoas major here is the iliacus. The iliacus and psoas major is combinedly known as the iliopsoas. So this is the floor of the femoral triangle. Now the roof of the femoral triangle is formed by the deep fascia or fascia lata of the thigh. So this is the deep fascia of thigh. You can see here. This is the deep fascia of thigh or the fascia lata of thigh. Okay. Now from the apex of the femoral triangle up to the fifth osseo-aponeurotic opening of the adductor magnus, here is a triangular. Here is a tunnel, musculo-aponeurotic tunnel, which is known as the adductor canal or the subsartorial canal, because it lies deep to the sartorius, or Hunter's canal, because a Scottish surgeon John Hunter ligated the femoral artery in the adductor canal for the surgery of the popliteal artery aneurysm in the popliteal fossa. So you can see here so this is the adductor canal. You can see the adductor canal is having three boundaries. One is the anterolateral boundary, which is formed by the vastus medialis muscle. One is posterior boundary or floor of the adductor canal, which is formed in the upper part by the adductor magnus. You can see here, and in the lower part by the adductor magnus. This is the adductor magnus, and this is the adductor longus. So floor of adductor canal formed in the upper part. You can see here in the upper part it is formed by the adductor longus, and in the lower part it is formed by the adductor magnus muscle. This is the adductor magnus muscle. And this adductor magnus muscle has two components. One is the hemisphere component, and second is the adductor component. You can see these are the vertical fibers and tendon of the hemisphere component of the adductor magnus muscle, and rest of the fibers, these are the adductor component of the adductor magnus muscle here. Now the contents of the adductor canal are: number one, femoral artery. You can see here in the adductor canal. This is the femoral vein. You can see this is the femoral vein here. Then saphenous nerve. You can see this is the saphenous nerve, and this is the nerve to vastus medialis. So these are the four important content of this adductor canal. Another component of the adductor canal is you can see here, this is the descending genicular artery. This is the descending genicular artery of the femoral artery in the adductor canal. Okay. Now you can see here it is saphenous nerve. It pierces the roof of the adductor canal and becomes cutaneous. So you can see here this is the saphenous nerve which is piercing the this roof of the sartorial subsartorial canal and becomes cutaneous here. Okay. Now I am showing the one important nerve is here, the femoral, the content of the femoral triangle. This is the lateral femoral cutaneous nerve of thigh. You can see this is very important nerve here. This is the lateral femoral cutaneous nerve of thigh. This is the lateral femoral cutaneous nerve of thigh here. It is very important because sometimes usually it passes beneath the inguinal ligament and passes through the superolateral angle of the femoral triangle here, but sometimes it comes from abdomen to the thigh by passing through the substance of the inguinal ligament, and here it can be trapped, and by trapping of this nerve patient complains paresthetic sensations on the lateral part of the upper thigh, lateral side of upper thigh, and this condition is known as meralgia paresthetica. And this condition is just because of entrapment of the lateral femoral cutaneous nerve of thigh, which crosses the superolateral angle of the femoral triangle here, and it soon divides into anterior and posterior branches. Now I am going to the